Well, the total number of confirmed coronavirus cases across the globe will pass through 2 million in the next 24 hours, and the number of deaths, 120,000. The virus has swept through parts of Europe and the US with staggering death tolls. In Australia, 61 people have died. The control measures here have limited the spread, but there are concerning outbreaks in places like North West Tasmania. And countries around the world are dealing with a massive economic fallout. Here are today's key developments. Australia is expected to have a double-digit unemployment rate for the first time in 26 years. Treasury figures suggest the jobless rate will rise from 5.1 to 10% in the June quarter. That means about 1.4 million people out of work. Two hospitals in the northwest of Tasmania that were closed yesterday in Burnie will undergo a deep clean. Members of the Defence Force have been called in to help deal with the outbreak. In the United States, more than 23,000 Americans have now died, but authorities say the number of new infections continues to flatten. In New York State, the number of deaths has risen above 10,000. France has extended its lockdown measures for another month. Anyone who goes outside is required to carry a document stating their reason for leaving home. Meanwhile, Spain has begun easing its lockdown measures, allowing building sites and factories to reopen. But the World Health Organization is warning countries that the lifting of any restrictions should be done slowly and on the basis of protecting people's health. 1.9 million people around the world are now infected, and that'll rise to 2 million soon. OK, so let's take a look now at some of these key developments for today. First, those Treasury estimates for here in Australia on expected unemployment spikes. Political reporter Nour Haydar joins us now from Parliament House in Canberra. Nour, good day. So take us through what Treasury is forecasting.
Well, Joe, it's expected that some 700,000 Australians will lose their jobs before the middle of this year because of the coronavirus pandemic. Federal Treasury is forecasting that Australia's unemployment rate will hit 10% this June quarter before the coronavirus really took hold and forced the shutdown of many businesses. Australia's jobless rate was 5%. Now we're told Treasury modelling shows that that would have tripled to 15% if it weren't for the government's JobKeeper wage subsidy scheme that passed the Parliament last week. But still, it is going to be the first time since 1994 that Australia's unemployment rate has hit double digits. Now, we heard from the Prime Minister this morning. He was speaking on breakfast television and he said it would be many weeks before restrictions would be lifted in Australia. He's urging people to be careful and to be patient, saying he doesn't want, quote, the horror show that has happened elsewhere around the world to happen here in Australia. And he says that these job figures, these unemployment figures are a tragic situation.
Well, it's a heartbreaking number. At unemployment at that rate, hundreds of thousands of people losing their jobs. It is just absolutely heartbreaking, but you're right. The JobKeeper program means that we'll be able to limit that devastation. And also we've got the doubling of the JobKeeper program, which means that those who do find themselves unemployed will be able to gain access to a support that we've never seen in this country before.
And so Nour, the Prime Minister there mentioning this JobKeeper scheme. When will money become available from that?
Well, money under the JobKeeper program will begin flowing to eligible businesses to pass on to their employees from next month. That will be backdated until March 30. We're told that more than 800,000 businesses, that includes sole traders as well, have so far registered to be a part of that scheme. Joe, that's the scheme that will provide $1,500 a fortnight to employees over the next 6 months, not to be confused with the Job Seeker program, which is the rebadging of the New Start allowance, which has been boosted to $1,100 a fortnight. But the government expects that some 6 million workers will receive assistance under the JobKeeper program, and the government hopes that will help the economy bounce back on the other side of this pandemic.
And Nour, the Prime Minister also had a bit to say about this Wuhan wet market. There's been a lot of reporting about this wet market with suggestions it was the original source of where this coronavirus was transferred from animals to humans. There's not 100% certainty around that, but it's a possibility. What's the Prime Minister had to say about these wet markets reopening?
Well, the Prime Minister has described the World Health Organisation's decision to support these markets reopening as unfathomable. Now, as you mentioned, there is strong evidence that the coronavirus transferred from animals to humans at a wet market in Wuhan. These are markets where there are live animals are sold and traded. Now, the WHO says it doesn't support them staying permanently closed because they are a source of livelihood for many people and a source of food for many people. But the Prime Minister has told Channel 9 this morning that really is quite a shocking decision by the WHO.
Well, I think that's unfathomable, frankly. I mean, we need to protect the world against potential sources of outbreaks of these types of viruses. And look, it's happened too many times. I'm totally puzzled by this decision. I mean, we don't have them here in Australia, and I'm just puzzled by that decision.
That's the Prime Minister there responding to a decision by the World Health Organization to support the reopening of wet markets in China, Joe.
Okay, Nour Haydar reporting there from Parliament House in Canberra. Okay, so now let's take a look at what's happening in the states and territories around Australia. New South Wales has recorded 7 new infections overnight, bringing the state's total to more than 2,800. Reporter Jessie Dorsett joins us now from Sydney. Jessie, g'day. So, yeah, just take us through those latest numbers.
Yeah, well, the downward trend has continued, Joe. In the last couple of hours, the 3 biggest states have reported their most recent cases. 7 in New South Wales, 10 in Victoria and 11 new cases in Queensland, which means 6,394 people in Australia now have COVID-19. We've heard from a lot of the health authorities this morning that they're encouraged by these numbers, but we have to stay the course with the current restrictions because that's why there has been a suppression. Certainly Victoria and New South Wales have indicated that they will be broadening their testing criteria. Here in New South Wales, in Sydney in particular, they've nominated particular hotspots where there's been community outbreaks, community transmissions, and in Victoria they're saying that they're going to have the country's biggest testing regime. In New South Wales in the past 24 hours there have been 2 more deaths, a 74-year-old woman and a man in his 70s. That brings the national death toll to 61, Joe. Both of those people were passengers on the Ruby Princess cruise ship, which led off thousands of people into Sydney last month. The police investigation, the criminal investigation into that is continuing, and we've heard from Mick Fuller, the New South Wales Police Commissioner, this morning. He says that they've been receiving many tip-offs from the public and this investigation is going to take another 5 months.
Homicide investigators have been interviewing crucial witnesses over the weekend and will continue to do that this week. Over 200 calls to Crime Stoppers. Each one of those has to be traced down. There is a chance we have to interview every member, every passenger on that ship to ascertain their health and what exactly happened. So, I mean, this is a large-scale investigation.
And we should just mention with those figures from over the holiday weekend that in some states there was less testing than that has been done previously. So it may be the case when they increase testing that those numbers pick up again. We'll wait and see. But Queensland pointed out that it had actually maintained its testing numbers over the weekend. Just hearing from the Queensland Health Minister, Stephen Miles, there in the last 10 minutes or so. And Jessie, so explain for us where you are there in Western Sydney and what's happening there.
We're outside an aged care facility in Penrith. It's called Newmarch House. There has been an outbreak of coronavirus here. Of course, a lot of aged care facilities have been locked down for some weeks now to protect residents from the virus. But in this particular instance, the threat came from within. A worker attended work 6 days straight when they were sick. And on the weekend, they tested positive for coronavirus, as did another resident inside the home. So those people are now self-isolating and being cared for, but we know that there are another 6 staff members at Newmarch House and 4 residents who are experiencing symptoms of coronavirus. Anglicare runs this aged care facility. It says that it's enacted all of the appropriate protocols, all of the staff are wearing PPE, and we've seen that ourselves out the front here as we've seen some come in to work and others leave their shifts. And they say they're deploying specially trained staff to manage the outbreak here. Joe?
Okay, Jessie Dorsett reporting there from Sydney. Okay, let's go to Tasmania now. Medical assistance teams and defence personnel will arrive in Tasmania's North West today to assist in the decontamination and reopening of the hospital at the centre of a coronavirus outbreak. Reporter Laura Beavis joins us now from Hobart. Laura, g'day. So what's happening at the hospitals on Tasmania's northwest coast? And this is in the town of Burnie, isn't it?
Yes, well at the moment, Joe, the North West Regional Hospital and the North West Private Hospital in Burnie are being emptied of all but cleaning staff and a senior health department outbreak investigation team. Patients have been moved to other hospitals in the region, the Mersey Community Hospital and the Launceston General Hospital. About 1,200 staff have been sent into self-isolation and with their households as well in self-isolation. That means about up to 5,000 people on the North West Coast are now in enforced self-quarantine for 14 days. Now the aim is to do a deep clean of those two hospitals and have them ready to reopen the emergency department at the North West Regional Hospital within about 3 days. The rest of the two hospitals within about 14 days. This outbreak that started in the North West Regional Hospital has so far led to about 60 identified cases of coronavirus. And the government's really keen to jump on top of this quickly. The North West Coast is one of the worst areas where this could happen, really, because it's got an older than usual population, there's a high level of underlying chronic disease, higher levels of poverty than other parts of Tasmania. So it's really the last place you want this to happen, and that has caused the Tasmanian Premier to take what he says is unprecedented action of actually shutting down two hospitals in the region to try to get a fresh start and completely cut off this outbreak. We're also seeing a ramp up of testing in the area. New drive-through testing has opened, and we heard yesterday from the Deputy Health Director of Tasmania, Dr. Scott McEwen, that about 80 people or so are being tested a day. They want to get that up to about 300 people, just so they know they've got on top of this.
And are there further restrictions on the wider population there in the northwest of Tassie over the next couple of weeks as well?
Yes, well, the Northwest has gone into what is the full shutdown that the Tasmanian Premier had been saying Tasmania itself might be forced to do at some stage in the future. It means all but essential services have now been forcibly shut down. Only businesses that provide essential services, so things like food businesses, supermarkets, greengrocers, bakers, medical services, car repairs, petrol stations, they're the only ones that are allowed to stay open. All other businesses, unless they've got an online selling platform or they can do home delivery, have to shut down. That includes some of those big box stores like Kmart, Target, Harvey Norman. The hardware retailers, like for instance Bunnings, are now restricted to only selling to registered tradespeople. And that of course has meant that on top of the job losses that had already taken place, hundreds more people have lost their jobs in the northwest. But again, the government, the Premier keeps saying he's making no apologies for this. They really see this as a really serious situation that they're trying to get on top of quickly.
And Laura, is it clear what case number 1 was there in the northwest of Tassie?
Well, it's not clear exactly what the source of the outbreak was. As I said, there's an investigation team in the region. There's a quite extensive investigation that's happening, both to find the source of the outbreak, but also, and health authorities have insisted to us about how important this is, to contact trace anyone who's actually diagnosed, to make sure they jump on immediately, all of their contacts, test them. The Deputy Public Health Director, Dr. Scott McEwen, did say yesterday, he acknowledged that one possible source would be a passenger from the Ruby Princess cruise, an elderly woman who died in the hospital about a week ago. Obviously that's being considered as a possible, first case that might have led to the infection, but they're trying not to rule out any possibility before they have all the evidence. One of the things the team is actually doing is sort of DNA genotyping the virus that the diagnosed people have, sort of using DNA like you would in a normal criminal investigation to try to trace back through that to exactly what the source was so they can match it. So we don't know yet, but we are expecting to know the answer in a couple of weeks.
Yeah. Okay, Laura Beavis reporting there from Hobart. While Australia appears to be limiting the spread of the virus effectively, authorities here are warning that spikes in case numbers could happen at any time. Health Minister Greg Hunt says it's important that Australians do not get complacent.
Australians are doing magnificently. We've seen real progress. The rest of the world would overwhelmingly in a heartbeat swap positions with Australia. We need to stay the course, and we need to do this for a very real reason, that it saves lives and protects lives. So magnificent work so far. We've seen daily infection rates fall to less than 2% daily growth. In other words, the curve really is flattening, but it hasn't stopped. And so we need to continue doing what we're doing, because these outbreaks could take lives, they could overwhelm the health system if they were left unchecked, and that's why we still have a considerable period of time of difficult restrictions, but at the same time we're planning that road out. There has been a continued slowing of the growth rate or flattening of the curve throughout Easter. We will review what's occurred, but Australians have overwhelmingly done an amazing job over Easter. The average transport, City Mapper, it's available to everybody, shows this. Movements have been about 12%, so under 13% of what they normally are at this time of year. And that's a very difficult thing for all of the businesses and families, but for defeating this virus, it's just an immensely important asset and personal contribution by everybody. The PM this morning made it very, very clear that there's an investigation going on, and that's an appropriate thing to happen. At the same time, we need to ensure that we are dealing with testing and tracing and containment in cases such as this. The local containment process, what we call the rings of containment that were outlined in February as part of the pandemic plan, Tasmania's moved immediately to implement that. We're then supporting that with the Australian Medical Assistance Team, or AUSMAT, and a military medical team that will operate to AUSMAT that's supporting the locals. And that's the country working as a whole. But there will be outbreaks, there will be challenges. The rest of the world would rather be where we are, overwhelmingly, but that doesn't mean we're out of this. We've got a long way to go, but we are making progress on a scale far faster than any of us had dared hoped only a month ago. Any person can catch the virus and inadvertently spread it, and so the difficult, hard restrictions that are in place, and we are apologetic that this has to be the case, but absolutely resolute and resolved that it must continue to be the case. They apply to all of us because anybody could pass on the disease inadvertently, and even a person in their 20s could catch it in a way that could be catastrophic for them. They are less likely to have a catastrophic outcome, but just as likely to pass it on. Then in terms of the economics, what we've done is create two enormous programs: JobKeeper to keep people employed, and then JobSeeker for those that are unemployed, with significantly increased benefits. So it's a very difficult time, but the more we do now, the stronger Australia's position, and that means that we'll be in a better position economically than so many other countries, and a better position to help each of these individuals.
Health Minister Greg Hunt there.